Hi everyone, Dr. Remy from Pain Free and Fit. Today we've got a great home self-stretching healing exercise to help with your carpal tunnel syndrome. Hope you enjoy. So this stretch addresses a very typical problem with many people that have carpal tunnel syndrome, which is a tightening of the flexor tendons and fascia that runs through the carpal tunnel area. Many times from typing, gripping, too much work and posture where we have the wrists bent and not in neutral or extended, we get a tightening in our finger tendons, in our wrist tendons that run and attach to muscles and fascia that run right up our arm and actually envelop and attach to the pec or chest muscle as well as the latissimus dorsi or back muscle. And many times forward shoulder posture, slumping posture all has a tendency to shorten and tie down these areas, which then shorten and compromise the available space for that median nerve that's running through your carpal tunnel area. So there's a very easy stretch to do. You're going to choose something where you can grip backwards and relax on something for a passive stretch. We're going to engage our arm by bringing it up and back. So that way we're stretching the pec and the lat. And we're going to reach as high as we comfortably can. We're going to lean our head away from the affected side. And we're going to hold on to something so that we're bending our hand backwards. Do you see that? My fingers and hand are bending back. And that's going to help stretch all those muscles from the finger, through the wrist, through the forearm. My elbow is rather straight, and I'm going to hold that for 2 to 4 seconds to stretch the nerve fascia and the nerve itself, which many times has scarring or adhesions in it in carpal tunnel. And then I can release, wait another 2 to 4 seconds and go back. Or to stretch the fascia that envelops all the muscles and tendons, I can hold that stretch longer, up to 1 to 2 minutes, until I feel a slow release of the shoulder, of the back latissimus, of the front and inside of the forearm where those tendons come off of. You want to keep in mind your own postural faults and mechanical issues while doing this stretch. If you have a tendency to protract or round your shoulder on that side, you want to make sure you're including that correction with this stretch. If you have a tendency to tip your shoulder blade, meaning the bottom of the shoulder blade lays off the rib cage, or if you have a tendency to abduct, have your shoulder blade turn outwards at the bottom edge and inwards on the top, you want to correct that actual posture. If you have a tendency to have a forward head tilt, you want to include all of these corrections for your unique dysfunctions as you're doing this stretch, because that's helping to stretch the fascial linkages from your neck, from your shoulder blade and chest complex that are contributing to the tightness running down to your carpal tunnel. Again, if you don't know what your unique postural issues are of your upper back, your shoulder, your neck, I invite you to go to either the Pain Free and Fit or Posture Size website. We have a free body analysis there that you can learn about that. So try this stretch. You can do this 2 to 3 times a day. Remember, all stretches should be comfortable. A slight feeling of pulling is fine, but you should not feel a major sensation of pulling. We're trying to stretch both muscle fibers, fascial fibers, as well as nerves with this. So we want to make sure it's a mild stretch. Once the stretch releases and you feel in that longer stretch where we're emphasizing the tendons and the fascia and the muscles, once it releases between 15 seconds and 2 minutes, then you can increase the stretch by bending the wrist back a little more, raising the arm up and back, or rotating your body away and leaning your head away a little further so you feel the stretch again mildly. And you can do 2 or 3 of those stretches 2 to 3 times a day. If you like this video and would like more helping with carpal tunnel syndrome or neck and shoulder related disorders, please subscribe to our channel. We've got a lot of great healing exercise videos for you there. If you'd like to help me share this information with others, give me a thumbs up below, leave your questions or comments, and I'll do my best to get back to you. I hope this video helps you with your carpal tunnel syndrome.